Hello, everyone, and welcome to the first edition of the Diabetes Care Summit. I'm Dr. Barbara Akimbua, and I'm your health buddy. This summit is for you if you've been diabetic for a while and you've been struggling with keeping your blood sugar controlled, either because you have problems knowing what to eat, when to eat, how to eat, what else you need to do to keep healthy, or you do know these things, but it's difficult to be motivated. It's also for you if you have an elderly parent who is diabetic that you care for and you find juggling medications, clinic visits, meals, and then illnesses in between overwhelming. Or you're a beautiful married woman and all you would love to have is a normal pregnancy and delivery. And instead, you keep having miscarriages and stillbirths as a result of complications of diabetes. Or it could be your husband. He is the one who's diabetic. And during sex, you have problems. It's either most of the time he can't get it up, or he has other problems while you're having action. It's also for you if you're a health enthusiast and you believe that prevention is cheaper and better than cure. And so you'd like to learn anything you need to know to stay healthy. During this summit, you listen to loads of interviews by different specialists, including myself. Some of the interviews are short and some are not so short. But I'd encourage you to watch each video till the end because there's loads of important health information and you're getting it all for free. So, once again, welcome to the Diabetes Care Summit. And don't forget, I'm Dr. Barbara Akimbua and I'm your health buddy. See you on the healthy side. Today we're going to be talking about using digital apps or mobile apps to access healthcare. So when I was growing up in the 80s and 90s, there were no mobile apps, there were no mobile phones, there were no computers. And now the whole world has gone digital. And we shop online, we bank online, a lot of advertising is done online, and the technology is currently in the healthcare sector as well. So how do we understand these changes? How do we know what to do and what not to do? So today I'm going to be talking to someone very knowledgeable in this field. I'll let her introduce herself and then we'll take it from there. So, Nkem, so tell us who you are and what you do.
All right. Thank you so much for having me, Barbara. My name is Nkem Dilimuwaji Bell, and I'm the CEO of FutureSoft. FutureSoft is an IT service company that is focused on digital marketing as well as digital transformation consultancy.
Okay, thank you. So I'm happy you mentioned digital because the first question I'm going to ask has digital in it. So what does going digital mean? Everything is digital now. What does that mean?
I think it just means that your records are no longer paper-based, right? So it just means that everything that you do, you basically take your manual processes and look at how do you use technology to optimize those processes, right? So that could be using email instead of having files in your office, having a file management system. So it can be very basic things. It can be using WhatsApp for your communication with maybe vendors, and them sending you pictures of things and you selecting instead of actually going to their stores and things like that. So it can be anything from sort of that type of very basic stuff to more advanced things like AI, blockchain, and those type of things.
Okay. So what changes has going digital caused in the healthcare sector?
So I think that it's done multiple things, right? So I think the first thing that it's done is to sort of democratize access to healthcare data, and also healthcare solutions, right? Because all you now need is basically a smartphone and you can access information. First of all, I think that, when you start with basic websites like WebMD, where excuse me, you have, information about pretty much any sickness, with symptoms and different things. Obviously, it leads to lots of false diagnoses and many people thinking that they are doctors themselves. But I think just being empowered with access to information is very important, because then you can also verify what it is that your doctor is actually telling you. I think the second thing that it's done, it's also sort of made the world a little bit smaller. So when we think about telemedicine, right, it gives the ability for specialists to access patients that are not where they are, right? So you can talk to a specialist in America, but you're in Nigeria, and you can send them all your details, your test results, your X-rays, and whatever it is that you've done, right? They can review it, and then they can have a video conference with you to speak to you, right? And then I think the third thing is it's been given us the ability to also track our health, right? So there are a lot of health trackers, and it starts with basic fitness trackers, right? Where you're tracking your steps, you're tracking your resting heart rate, you're tracking, sort of the exercise that you do. You can enter what you eat, you can enter what, how long you sleep, how much water you take in. And I think that generally, can lead to sort of us taking care of ourselves better, because when your Fitbit tells you you're only taking 1,000 steps in a day, you're like, oh my God, what's happening? Let me go for an actual walk, right? So I think that also puts our lifestyles into perspective a little bit, right? Which I think is very important for awareness, especially because with digital, most people are very stationary, right? So we sit all day in front of our computers, and we're not actually moving. So I think those type of basic health trackers are very important. And then obviously you have the more advanced ones that, sort of track other types of data, whether it's diabetes data or any other type of, sort of data that you need to input on a daily basis.
I like that. I like the idea of tracking, because a lot of the time we think we're doing things and we're actually not meeting targets. So it's like looking in the mirror and actually seeing exactly what you look like or what you've done.
Yeah.
So that's good. So what are apps? What's an app?
So an app is basically just an application that lives on your mobile phone. So, I mean, an app like WhatsApp is an app, Zoom is an app. Any type of technology that has been bundled into, sort of like an executable file is considered an application, right? So if you have a smartphone, you would have access to an app store, whether it's the iOS App Store or Google App Store. And in that app store, there are many different applications. So you can search for applications that, teach you a language, or an application that you can use to chat, an application that you can use to measure your steps, or whatever it is, right? So those are basically what are considered apps.
Okay, so an app helps you do something.
Yes.
Okay.
Most of the time, at least.
Okay. So what are apps currently used for in the healthcare sector?
I think I've already, sort of talked about that a little bit, right? So I think there's a lot of the actual health tracking. I think there's also health communities that you can access via apps. And then obviously, there are really great, sort of apps that bring together community and the tracking for, pregnancy and things like that, where as a, expecting mom, you every week get updates of, the size of the baby and what you should be feeling and what, is going to happen to your body. And I think that that's actually quite empowering, right? And then obviously you also have access to the community of other expecting moms or moms who already have newborns, where you can then also ask questions, and I think that sort of access to other people is really, really important, because you then, sort of have that really big element of connection, So I think in the healthcare space, that's one of the key things that apps have really done to allow us to track, to allow us to have access to information, to allow us to have access to community as well. Whether it is to support, right? So, I mean, imagine you're a cancer patient. There are lots of support communities out there, right? And I think that's really important because the people around you don't have cancer and they don't know what you're going through, right? So in as much as they want to help you and want to understand, they probably have no idea, right? And at some point they probably get very irritating and you're like, okay, yeah, thanks, but I need to talk to someone who actually knows what's going on, right? And who feels what I feel. So I think that community element is really important. And then obviously, like I mentioned earlier, the access to specialists, right, through technology. And this could be via chat, it could be via video call, right? So I think there are different methods of accessing healthcare specialists today using technology.
Okay, that's great. So it gives they give information, health information, they give access to healthcare providers, they help you track and keep records of your health data, and they provide access to a community that can support you, especially a community that you can learn from. Okay. Hi, have you heard of Soyo, the new diabetes care app? Studies show that the best medicine to take for diabetes is to get education about it. Because if you understand how it affects your body, you'll know better what you need to do to fight it. It will also help you to take care of someone else with diabetes. With the app, you don't just get education, you also get to make your management plan either for yourself or the person you're taking care of. There are also lots of other features like meal plans, medication, and other reminders to keep you on track. And if you fall off, don't worry, just get back on. This is how families can live healthy and happy with diabetes. Don't be left behind. Download the app at soyo.web.app to care for yourself or someone else with diabetes. The next question I was going to ask was, how can we use apps to solve healthcare problems in Africa? But with what we've gone over, that's basically what we can solve, what we can use apps for in Africa. And I also think that because our culture and our traditions are a bit different, we will have to create apps that suit us. Because with the apps that are created for people in the West, they are based on their own culture and their own beliefs and their own healthcare system, which is different from ours. Mm-hmm. So, what should users look for in a health app?
I think first of all, you download a health app to solve a problem for you, right? So the question is, does this app actually solve this problem? Does this app have the information that I need? If you're looking for an app that has like a community and then you download one that doesn't, then it doesn't really solve your problem, right? So I think it's very personalized in terms of what you're looking for. But I think the main thing is it has to solve your problems. It has to give you information, right? You probably want, some level of, sort of data and, things that you can track, things you can input in order to get more information about whatever the condition it is that you're facing, right?
Good. So how can we protect ourselves and our data? Because health data is personal. It's I don't know what word to use, but it's nobody wants their health data all over the place. It's just like banking data. And a lot of frequently you hear people's data has been stolen or there's this security breach in a data system. So how can users protect themselves while using a health app?
I think the first thing is to actually read the privacy policy and understand what is actually going to happen with your data, right? And then also look at what jurisdiction does this app fall under, right? So in Europe, you have GDPR. In Nigeria, there's NDPR, which is basically protects your data privacy. And you just need to understand what are the laws, right? What data can they share? What data can they not share? A lot of the apps also now ask you on a case-by-case basis, do you want to share this data or not, right? And then you have to consent. So you also have to make sure that you're paying attention and you're not just clicking, and then suddenly they're like, oh, we've used your data to do a case study. And you're like, what? So just being aware of those things. And most users we don't read the privacy policies, we don't read terms and conditions. We just like, yes, sign up, okay, yeah, verify my email, that's it. But I think especially when it comes to this type of data, it is important, right? And then also looking at the reviews on the App Store, right? So if there's an app that has 1 star and everyone's complaining that they've put in their data and then the data was used for something else, then clearly that's not a good app, right? So I think just making sure that you read the reviews and look at what the recommendations are is important. Data breaches will always occur, right? The question is never if you get hacked, it's when you get hacked and what you're going to do about it. That's the truth of it, right?
All right, so paid apps and free apps, what are the pros and cons of each?
I mean, I think free apps usually sort of have some level of or some way that they still monetize them, right? Because nobody is doing anything for free. So even a platform like Facebook, right? They thrive on actual advertising, right? So they make money from businesses that are on there that are advertising, right? So at the end of the day, there never really is any free lunch. But obviously, there's also apps, right? So for example, if you buy a Fitbit, it comes with a free app, right? Within that app, you can then subscribe to the premium service. The premium service gives you access to additional things like exercise and meal plans and stuff like that. So you always get more value when you pay for it, right? So I think it's always, the question is always like, what do you want to get out of it? What do you need it for? How important is it for you to have that premium access? Because most apps, even the paid ones, are not just totally paid. There's some level of freemium, right? Where you have access to basic functionalities just so that you can come in and you can see, and then you pay in order to get access to more functionalities, right? I would always say, pay, because at the end of the day, you then get more value for what, and you get access to more data, you get, sort of more stuff that is valuable to you. So, but again, it really depends on, sort of what you want out of it, right? If all you want to do is count your steps, add how much water you're drinking, and check how many hours you're sleeping, and you don't need a meal plan, or maybe the meal plan is not even like, you talked about apps not being customized to the Nigerian environment, right? So if the meal plan tells you to, eat stuff that isn't even available here, then where's the value for you, really, right? There's no value, because it's like, okay, I can't cook this stuff because it's not even available, or it's super expensive. And I don't want to now break the bank just because I want to eat healthy when there are other options for me to eat healthy, right? So I think it's what is in it for you? What do you need out of it? And then you can decide whether you want to pay or not. But usually, once you get into the premium subscription, if the free one is sort of supported by advertising revenue, then you don't have ads in the premium one. In the free one, you would have ads. So like, if those type of things bother you, then obviously just get the premium, and then you're free of those things. So yeah, I think those are sort of the major pros and cons, to be honest, because it's sort of case by case basis. There are apps they're free for a reason, right? So when you look at an app like Baby Center, for example, right, which is basically a platform that I described earlier for expecting moms and moms that just given birth and have like children under 1 year, right? That platform is actually owned by Johnson & Johnson. It is 100% free because they mine the data that they get from it, right?
Wow.
Okay. They target their advertising to you, right? Because they know that, okay, your due date is the 10th of March. So within 2 weeks, you're going to need diapers, you're going to need baby cream, you're not going to need nipple cream, you're going to need this, you're going to need that, right? So it's very, very easy to target you with advertising. Because you're already invested in it, right? You're already part of that community, you already trust it. So whatever you see there is sort of, you're like, I need to get that, right? And then obviously, it's very easy for them to also then in the forums to have, moderators that then also talk about their products. So, there are different ways of actually that brands use marketing, right? And this is one of them, right? They build a community, they create a lot of content, a lot of value, but they use the data that comes in because people see the value, right? So at the end of the day, you are still paying some way, because by the time you now go and buy baby powder that is Johnson & Johnson, just because you've seen it there, you don't know that you've been influenced, but they're making sales and they're happy. So there are different models, but I think it's always about what value do you derive from it, and is it beneficial to you?
That's very interesting. So a lot of the time people feel once they've paid for something, then the onus is on the person or whoever it is they've paid to do the work for them. So with regards to tracking health indices or tracking your health, your habits or your health behavior, will the app do everything for you, or you have a role to play? Because
I think you always have a role to play, right? So there are certain things that the app can track. So like in the case of Fitbit, you're wearing the device, right? You need to make sure it's charged. You need to make sure that you're wearing it. If you leave it lying around, it's not going to track anything. So that's your duty on that end, right? But then there are still things that you have to enter, right? It doesn't know when you're drinking water because it's a wearable device. It knows when you're moving. It can read your heartbeat, it can track your sleep, but it can't do certain things like putting in, whether you exercised or, sometimes it's able to detect. So if you really do high intensity exercise or you're walking for a long time, it can detect that you exercise, and it tracks that. But there's also a function to sort of log the data, right? Now, if you had diabetes, for example, and you were using a diabetes app, right? So there's some of the diabetes measurement things that are linked to an app, right? Because they're basically digital. So they transmit that data to the app directly, and you don't really need to do much, right? So you need to make sure that you're syncing the data. But then there are some apps that are just like, this is an app, you can put in your data so that you have your records, but we don't have the product to actually help you measure your sugar level, right? So that type of app, you then buy your measuring device, and then you input the data manually every single day. So if you have to measure your sugar levels, let's say, I don't know, 2 or 3 times a day, you have to put in that data in order for you to have the data, right? And then obviously they then use the data to show you trends. They use the data to make recommendations. They use the data to help you with stuff. So that's where the value add comes in, but you still have a role to sort of play in that entire, sort of in using it and in actually deriving value, right? So I mean, data doesn't come out of thin air usually. It's usually, you have to do an action in order to generate the data. So that's where, so especially with tracking, it's really important that you then are very consistent with it, because if not, the data also can be inaccurate, right? So if today you've had too much sugar for whatever reason, but you normally don't, but that was the only day that you've tracked, then it's going to show you like, okay, you're about to die. And then, but that's not really the reality of your health, right? Because maybe that day was your birthday and you decided like, screw it, I'm going to eat cake, right? And you probably shouldn't, but you did. And that's why you have that spike. But then all the other days of the year are normal, right? Or like wherever your levels are supposed to be, and they're regulated, and you're actually okay in managing your sugar. So you then, like that data would be skewed simply because you've only entered one day, right? So it's data accuracy really comes from large amounts of data, and large amounts of data can only be generated if you're very consistent and accurate with generating the data and inputting the data and making sure that the data that you've put in is also accurate, in terms of putting in the right time, date, and all of those things.
So the app is your health buddy.
Pretty much, yeah.
Yeah. Okay. So what's one piece of advice would you give anyone using an app to monitor their health? I know we've talked about a lot of things, but when you're talking to wise people, sometimes you forget to ask something. So is there anything else?
I think the main thing, like I said, is to really be consistent about, how you use it, and to, ensure that you're clear on how secure your data is and how secure the app itself is, especially when it comes to things like inputting your payment details, always making sure that, when you also download the app, it's from an app store that you trust, and you look at the reviews. So I think just overall being responsible in, sort of accessing and engaging with the digital and virtual world, right? Also looking at things like, does the app have access to your address book? Does it have access to your camera? Does it have access to different things, right? Can it listen to you? Those are things that, I mean, our phones listen to us anyway, so it doesn't really matter. But, I think, those things are still important, because you obviously wouldn't want your app to be filming you when you've not actually allowed it and you're not in control of that, right? You wouldn't want the app to, sort of listen in on conversations or to get access to every single contact in your address book. So when it asks you for access, you need to be clear on what that access is going to be used for, right? Is it so that you can make recommendations, or is it so that they can mine that data and then start advertising to your friends, right? So just, in general, I think be conscious about, sort of the things that could impact you in a negative way when you're using any type of technology, and just be careful. Read the text that it says before you say okay and approve, and just make sure that you're clear on how much you're paying, how frequently you're paying, and stuff like that, so that you don't get surprised. Because a lot of the time, and also especially when they're in-app purchase charges, right? So just being clear that you have to accept those, and not, sort of that they're just automatic, because if not, you can just, suddenly have a very high bill on your card.
Okay. So thank you. So if I hear you correctly, at the end of the day, even if you're using an app, you're responsible. You're responsible for making sure the app is helping you achieve your goals, and you're responsible for making sure that it doesn't harm you in any way by using your data without you knowing. And thirdly, you need to input data to get the most out of the app. Yeah. So thank you so very much, Nkem. I learned too, and I hope everybody watching this, or I'm sure everybody watching this, will learn about how to use apps to manage or to better manage their health. So thank you. I'm glad you took my advice and watched the video till the end, and I hope you learned a thing or two. So don't forget, watch the next videos, because there's still lots of information that will be really beneficial to you. Don't forget soyo.web.app. Download it now. See you in the next video. Bye.